5 questions that you want to ask your doctor and yourself when you're asked to do a liver biopsy. Number 1, why do you need a liver biopsy? We do liver biopsy for 2 major purposes: to either target something in the liver, maybe a growth, maybe a lesion, maybe something abnormal in the liver. We want to take a tissue sample from the particular nodule to find out what exactly it is. The second type of liver biopsy, we want to target the liver. What we call is a non-targeted liver biopsy. We just need the liver tissue from any part of the liver to find out if there's any acute or chronic liver disease. So ask your doctor what is the reason why they want you to do the biopsy. Number 2, ask the doctor what is the risk involved. Roughly, the risk of liver biopsy, it depends. Roughly, from my experience, 1% risk of bleeding. When we poke something through the skin, muscle, rib cage into the liver to take some liver tissues, we may invariably hit the muscle, hit the liver, the rest of the liver, hit the blood vessel in the liver. Sometimes we hit the bile duct of the liver. We hit anything serious, anything important, we may cause bleeding or bile duct damage or a muscle, a blood clot in the muscle. So ask the doctor to explain to you what are the risks involved. Sometimes the needle have to go through the lung, may puncture the lung while going to the liver, and that may cause what we call pneumothorax. So ask what are the risks involved. Number 3, ask the doctor how they're going to do it. There are 3 major ways to do it. One is through the skin into the liver. Second way is through the big blood vessel here, what we call the internal jugular vein, into the hepatic vein, and to take a liver biopsy. That is safer in the sense that it doesn't have to go through so many layers in the muscle wall. But the problem is that the tissue we obtain is very small, and it is a non-targeted biopsy. We can't look at that particular lesion. Sometimes we do a transjugular biopsy and we find that the sample is too small and we have to repeat. Last one I've seen is that we do a laparoscopic biopsy. We put a camera through the belly button into the liver to take a direct tissue. That will be most direct, but they won't require general anesthesia. The next thing you ask the doctor is, are you fit for the biopsy? You are unfit for the biopsy if you have a bleeding tendency, if you have been taking a blood thinner or anticoagulant, when you have a bleeding tendency, when you have a lot of fluid in the abdomen, what we call ascites, or when you are very, very fat that make the needle difficult to aim properly into the liver. If you have any of these problems, or maybe many more, that may affect that may increase risk of the biopsy. So ask your doctor, are you fit for the biopsy? The next one is, ask the doctor, how will the biopsy results change the management? For example, I'll give you an example. If you have blood test consistent with an autoimmune hepatitis, it does not really matter what the biopsy show. We're going to give you steroids anyway. Then you may save the liver biopsy. Or if the blood test proposed suggests that you have what we call primary biliary cholangitis (PBC), again, you don't really need a biopsy to confirm it because you can give treatment and see how you respond. The commonest liver problem in Singapore right now is fatty liver or MASH, metabolic dysfunction associated steatohepatitis. Some doctor may want to biopsy the patient's liver to see how bad it is to confirm the diagnosis. But frankly, no matter how bad the MASH or the fatty liver is, treatment is the same thing, is weight loss. That means we either lose weight by medication, or by dieting, or by exercising, or all of the above. So if your treatment is going to be weight loss anyway for fatty liver, then why take the risk for the liver biopsy? So to sum up, ask the doctor why you want to do a biopsy, how he's going to do it, what is the risk involved, and ask yourself, are you fit for the biopsy? Lastly, ask the doctor how the biopsy result will change the management of your care. If the biopsy result will not change much, then maybe you don't need to do a biopsy. Liver biopsy is a complex procedure with risk involved. I've been in practice for 30 years. I've seen complications like pneumothorax, or sometimes bleeding, or even death. So I don't take it seriously. I don't take it lightly. All of us should take it seriously and only do it when it is really necessary. Dr. Desmond White.